welcome to NHIS in a Week. We bring you highlights of events within the authority and the scheme. My name is Vaida Ebichumwa Boateng. Now the headlines. NHIS launches Sunshine Policy. NHIS wins 2 awards at the prestigious Public Sector PR Awards. NHIS staff at the head office and CPC Accra undergo eye screening. Now the details. In conformity with recent board directive, the National Health Insurance Authority has initiated the Sunshine Policy that seeks to deepen accountability, transparency and social audit in relation to claims reimbursements to providers. The NHIA under this new policy has published claims payments made to credentialed healthcare facilities in all of 2022 to March 2023 on its website with the link nhis.gov.gh/payments, and will do so every month as a mark of keeping faith and staying abreast with all its valued stakeholders.
If you want to know the new inventions that NHIA has undertaken, for instance, the My NHIS app, which was also launched in December, we have a section where you can click, get in there and try and understand. For those who want to be credentialed under the NHIA, there's a section as well for you to go in there for providers. You click on the button and it tells you how to onboard your application. Years ago, everything was manual. NHIA has gone e-systems these days where your submission for credentialing to be a provider is all online. The process starts online and then we'll take you through. So at this point, you want to concentrate on the claims payment. So we will click in the green box. And then this is where it gives restrictions to users. So if you are a bona fide user, you would have your username and the password. For those who would have access, as has been named out, they will have their username and their passwords. So let's go. So once you put in your username and your password, you'll begin to start seeing data on claims that NHIA has paid over the past 2 years. So as we said, we have only uploaded payments that were done from 2022 and then the months which those payments occurred. So on the left-hand side, you see the year. When you go on the drop-down, you see 2022 and 2023. So if you go into 2022 and you select the month of January, the system will now show you all the payments that were done in January of 2022 and for which facilities NHIA paid for and for which period we are paying the claims for. So on this list, you'd see that the first column is the providers who have submitted their claims and has been duly vetted by the NHIA. On the left-hand side, the location of the facility, the amounts that were paid to them, and for which period these payments were effected. In fact, the last column is when the payments were actually done. NHIA does payments at least once every month. So on this occasion, you realize that all the payments were done on the 19th of January in 2022. And it was for periods as recent as November 2020. So this is a list. And it will not necessarily be payments for all the providers. It depends on who has submitted their claims to us and has been duly vetted. So it's not automatic that every provider may be on the list. So we have so many, almost 1,713. We will take another period, let's say June 2022. So for June 2022, the payments occurred on the 9th of June, and there's some periods that are listed next to it, and for the facilities that the payments were in respect of. That is also available here. Let's take December 2022.
According to the CEO, Dr. Bernard Okoboy, the Sunshine Policy seeks to throw light on claims payments made and emphasize that it will greatly impact stakeholders' confidence in the scheme and promote a congenial relationship among all parties.
So we are here today to announce that going forward from today, on our website, we now have a link where all the players in the healthcare sector have access to know what we have paid, when we pay the money, and for what we pay the man. So this morning, our Director of Corporate Affairs, with the support of our MIS, that's our IT department, will demonstrate how one can check to see how much Kolebu Teaching Hospital was paid this month and for which month they were paid. I normally say for which month because every month we try to pay some claims, but what we pay is not necessarily last month's debts that we are paying. It's possible that is what is submitted to us for the month of August. So as we speak, health insurance, if you count, we just paid for August 2022 this week, but last week.
Dr. Okoboy added that the NHIA is working hard to create more efficiencies in its claims management processes and to reduce the gap between amounts paid and the period for which claims have been duly submitted and vetted.
But for the past 20 years, all the payments we make to hospitals or facilities who have taken care of Ghanaians, nobody knows about what we pay to them. Not even the suppliers who give them the medicines that they give to patients. And we've realized over the years that this has been some cause for concern or a source of problem. And one may ask, what is the problem? If, for example, the National Health Insurance Authority pays 10,000 Ghana to Lekma Hospital, which is a bill for, let's say, last year, September, for taking care of patients, and a supplier who gave them medicines to give to us goes to Lekma, that you owe me 10,000. Please, if even 500 cedis, let me have some so that I'll know you are servicing the debt. There are occasions where the hospital will go like, oh, me for about 8 months now, Lekma has not, NHI has not given me anything. How does the supplier know that we have paid or we've not paid? There is no way to know.
He also assured stakeholders of the security of the technology that houses the information of claims payments.
You change them regularly. So what we'll do is that we've not set the rates or the period yet, but my IT team can advise that every month we'll review the password for them. Remember, the password is not the same for all the associations. Each one has a unique password, and we are giving to only the head of the association. It's deliberate. So the Ghana Pharmaceutical Association, if they have 100 members, you're not going to give to 100 people. It's information that you go access through your head. That is what makes it quite robust. So that as a head, we tell him that you are the only one who has it. If you get loose and everybody has it, it compromises the system. The pressure is on all of us. So that's assurance. Every entity will have a unique password, and the password will be reviewed periodically, so that even if someone gets it, the next time it will be difficult. No system is perfect. At least this will help them to access information, and the review or regular changes will be serving as a barrier.
The CEO of the National Health Insurance Authority, Dr. Bernard Okoboy, has been named the Best Outstanding CEO Support for PR Development at this year's Ghana Public Sector PR Awards held at the Chartered Institute of Bankers in Accra. The award, according to the scheme, is as a result of his efforts to establish the Corporate Affairs Directorate as an integral part of management since taking over as NHIA's CEO. His familiarity with PR and interactions with members of the PR unit allowed him to identify their needs and be able to provide the necessary support, which was also recognized by organizers of the awards show. Mr. Oswald Eswa-Mensah, the Acting Director for Corporate Affairs, was recognized as one of the top 25 PR leaders in the public sector. Upon receiving the award, Mr. Oswald Eswa-Mensah thanked the board and executive management as well as staff of the Corporate Affairs Directorate for their tremendous efforts and pledged to continue working even harder to make the NHIA's Corporate Affairs Directorate and their PR work a force to be reckoned with.
Yeah, thank you very much for the opportunity. I think it's so refreshing and fulfilling to find out that the work that we do for the Corporate Affairs Director at the time is being seen and recognized by the world over. I'm excited to be a beneficiary of this award, but most importantly, this award I have taken is not for myself, but I'd say it's for the whole team of 35 staff that work together very coherently at the National Health Insurance Authority. It's a well-talented team. I mean, I can't say more. I think that we have a very good team. We work well, we gel well, and the results are outstanding. It's been a relatively short time, but I believe that there's many more in the space, and we want to ask our stakeholders just to keep watching this space. We're excited about this, and it's all for the whole of corporate affairs. Thank you.
The Deputy CEO in charge of Admin and HR, Mrs. Yapokia Baden, has organized a training program for staff of the Private Health Insurance Directorate, the Legal Directorate, and the drivers at the head office in Accra. The training exercise was on the topic emotional intelligence. Here are some assets.
Was it accurately pick up emotions of other people, not understand their own, and understand what other people are thinking and feeling, so that you can empathize with them. They be useful examples. So who had the back at baby that now we should back at baby, I want to be related to that person who said, well, what was I experience until what you get. And I would I wash it. But just a man to staff with the dash. My friend is also again is because I have to empathize with you. Now we'll call it pharmacists or pass sorry or back then free.
The Private Health Insurance Directorate, the Legal Directorate, and drivers also benefited from a customer service and relationship training organized by the Corporate Affairs Directorate in collaboration with the Training and Development Unit at the HR Directorate. Here are some assets.
Some too, they find it difficult smiling. But let me tell you, with the customer service, whether you are prone to smile or not, you have to wear that makeup. Oh yeah, you have to wear that makeup. The makeup of what's habitually smiling. So the moment you see a guest at your desk, you just smile to welcome the person. Thank you, I love your smile.
Drivers at the head office of the NHIA can now breathe a sigh of relief as executive management provided them with newly furbished office to aid their operations. The provision of the new office was upon a request by drivers to management to find a convenient place of work for them. The CEO, Dr. Okoboy, and the Deputy CEO in charge of Admin HR, Mrs. Yapokia Baden, jointly commissioned the edifice.
Today, the 30th of March, we are happy to be witnessing this event. It's been so many years that the drivers have asked for an office, a driver's lounge, so that they can have a place to write reports, they can have a place to relax, they can also have a place to call their own, especially those who come from other regions and want to have somewhere to sit to answer to certain comments. And I have spoken to the head of the drivers, and they are very happy that we have given them this opportunity. And it is our hope that with this office, we'll see an improvement in their efficiency. But sometimes you're looking for them, you can't even find them on the compound. And they told us it's because they don't have anywhere sitting. But we provided them with chairs, with tables, with a TV, with computers, so that we can actually have a very functional office.
The drivers have an opportunity to challenge the CEO. So now, when I enter my office, they also enter their office. We would like to thank all the senior staff who are putting a lot of effort to make sure that this request actually gets executed, from DC Admin HR to Director Administration Mr. Venu, to all those who participated, estate,
Procurement,
Finance,
finance, procurement, finance, MIS, cost. And we also thank the head of the drivers, the national say national and international. National coordinator. I have a few words. Send it to let's try and maintain it. Yes. They have some is there a principle or law in economics? The law of the commons, or the rule of the commons, or the headache of the commons, where something belongs to everybody, but nobody is held responsible. I said, I as a say, and a touch my own need every minute. Now, I said, I don't know a conform. I say, so what you have to do, you work hard to keep the standard, how it is the first day. Men correct said they said you enter way after 6 months, now what you feel where you say no, it's not correct. And this goes to all of us. All of us. When you say office, if you know your office, the wall is dirty. I always say as for dirty wall is the easiest thing to take care of. You need 1 gallon of paint. If they don't give you, come and see me, I'll give you. Impression, very important. And at least if a timetable every week, you know one person who is responsible for maybe cleaning a table, doing this and that. Take charge. Head, take charge so that we are very calm.
The national coordinator of the drivers, Mr. Emmanuel Donko, applauded management for heeding to their request.
Transport office, 8 years CEOs, we spent 20 good years for net insurance. We are the 8 times CEO. We are the first time I'm in your office. And that's happy to say we are supporting you and help you move net insurance forward. Your 3G and 5G. I'm sure you will keep the place neat. Everything coming to Sofo by head office here. Any driver looking to head office, come and sit here and rest and enjoy yourself.
Now to our very final story. The eyes are among the most sensitive organs of the body and are considered to be one of the most important senses. Despite this, taking good care of our eyes is often ignored, resulting in many losing their sight or needing glasses. In the light of this, management of the NHIA has organized eye screening for staff at the head office and claims processing center of the authority in Accra.
We are starting with eye care or better sight for the road. We'll start right at the headquarters health insurance, cascade it across the country, and make sure that every taxi rank, every transport rank will try and get closer and find out the state of the sight of the drivers and see how we can support them to have a better sight. There's a direct correlation between eye sight and the speed of accidents. There are drivers who don't see, who are seeing stars, and if you don't help them, the day you sit in their car, they will take you very far.
This week on Health Tip, we'll take a look at cataract. This is how we wrap up this week's edition of NHIS in a Week. For details of these stories and more, do log on to our website www.nhis.gov.gh or follow us on all our social media platforms displayed on the screens. My name is Vida Educhumwa Boateng. Thanks for watching.